There is one mistake at age 65 that Medicare will charge you for every single month for the rest of your life. Not for a year, not until you fix it, forever. And here's the part that makes my blood boil, friends. Most of the people paying this penalty right now did nothing reckless. They didn't gamble. They didn't skip insurance. They had health coverage the entire time. They just had the wrong kind of coverage, and nobody sat them down and explained the difference. If you are 63, 64, 65, or you're still working past 65 and thinking, I'll deal with Medicare later, the next 15 minutes may be the most expensive 15 minutes you ever skip. Here's what I'm going to walk you through today. First, exactly what this penalty is and how it's calculated with real 2026 numbers so you can see what it costs. Second, the 4 traps that catch smart, careful people. And I promise you, at least one of these will surprise you. Third, the 3 enrollment windows and the exact dates that matter. And fourth, this is the part almost nobody covers, what you can actually do if this has already happened to you. Because there is a form most people have never heard of, and in the right circumstances, it can wipe the penalty out entirely. Stick with me to the end, because I'll give you one simple question to ask yourself tonight, and one date to write on your calendar that protects you from this entire mess. Grab a pen. The math today is very real. Let's start with Medicare Part B. That's your doctor visits, outpatient care, lab work, durable medical equipment. The rule is this. For each full 12-month period, you could have had Part B but didn't sign up. Medicare adds 10% to your monthly premium. In 2026, the standard Part B premium is $202.90 a month. So, 1 full year late, 10%, about $20 more every month. 2 years late, 20%, about $41 a month. 3 years late, 30%, about $61 a month, which is roughly $730 a year, and you pay it for as long as you have Part B, which for most of us means the rest of our lives. Now here's the detail that almost nobody explains, and I want you to hear it clearly. That penalty is not frozen. It is not a fixed dollar amount from the year you signed up. It is recalculated every single January against the current standard premium. In 2025, the standard premium was $185. In 2026, it's $202.90. That's an increase of almost 10% in 1 year. So everyone paying a Part B late penalty just got a raise on their punishment without doing anything. As Medicare gets more expensive, your penalty gets more expensive, automatically, for life. One piece of good news, and write this one down because it has saved people real money. The penalty counts full 12-month periods. If you're 11 months late signing up for Part B, there is no Part B penalty. 13 months late, and you owe 10%. So if you're sitting there right now doing the math, and you're inside that first year, move today. You may be able to walk away from this clean. Now the second penalty, Part D. This is the drug penalty, and it works completely differently. Part D is 1% of the national base beneficiary premium. That number is $38.99 in 2026, multiplied by the number of full months you went without creditable drug coverage. Then it's rounded to the nearest 10 cents and added to your monthly drug plan premium. Go 2 years without drug coverage. That's 24 months, so 24% of $38.99. About $9.40 a month permanently. And here's the part that gets people angry. It doesn't matter which plan you pick afterward. You could join a Medicare Advantage plan with a $0 premium. You still pay that penalty every month. Switch plans, move states, change carriers. The penalty follows you. It is attached to you, not the plan. There's also one more grace period worth knowing. For Part D, you generally get a 63-day cushion. Go 63 days or more without creditable drug coverage after you're first eligible, and the meter starts running. Put them together. Take someone who's 3 years late on both Part B and Part D. That's about $61 a month on the medical side and about $14 a month on the drug side. Call it $75 a month, roughly $900 a year, forever. And both of those base numbers climb almost every year. Over a 20-year retirement, at today's numbers alone, you're looking at somewhere around $18,000. In reality, it's more, because the base keeps rising. And quickly. So, nobody's confused. There's a Part A penalty too, but about 99% of people get Part A for free because they worked 40 quarters. If you do have to buy Part A, that penalty is 10% for twice the number of years you delayed, and that one actually does end. Parts B and D are the ones that never do. So how do careful, responsible people end up here? 4 ways, and I want you to check yourself against every single one. Trap 1. COBRA. This is the big one. This is the one I wish I could put on a billboard. When you leave your job, you get offered COBRA, usually 18 months of the exact same plan, same doctors, same card in your wallet, and it feels like coverage because it is coverage. But Medicare does not treat COBRA as coverage based on current employment. And that phrase, current employment, is doing all the work in this rule. Your Part B special enrollment period gives you 8 months to sign up after you stop working. But that clock starts the month after your active employment ends, or the month after your employer group coverage ends, whichever comes first, not when COBRA runs out. So picture it. You retire in March. You elect 18 months of COBRA, and you figure you'll handle Medicare when it expires. Your 8-month window actually opened in April, and it slammed shut in November of that same year, 11 months before you even thought about it. You are holding an insurance card that works, walking around inside a window that has already closed. Trap 2. Retiree coverage and severance health benefits. Same rule, same trap. If your old employer gives you retiree health coverage, or your severance package includes a few months of health benefits, that is not current employment coverage either. It does not hold your Part B window open, not by a single day. Active employment is the only thing that counts, yours or your spouse's. Trap 3. The 20-employee rule. This one catches people who are still working, still on a great plan, and doing absolutely nothing wrong. If you or your spouse work for an employer with 20 or more employees, that group plan is primary, Medicare is secondary, and you can generally delay Part B without penalty. But if the employer has fewer than 20 employees, the rules flip completely. Medicare becomes the primary payer the month you turn 65, whether you enrolled or not. Think about what that means. If you skip Part B, that small employer plan can process your claims as if Medicare had already paid its share, and then pay only what's left. Medicare didn't pay because you're not enrolled. So who pays the difference? You do. You get the penalty and the unpaid bills. It's the worst of both worlds, and it's why you have to know your employer's headcount. Not guess it, know it. And note that the count includes full-time, part-time, and seasonal employees across all locations. Trap 4. Drug coverage that isn't creditable. Your employer plan can be perfectly good on the medical side and still fail the drug test. Creditable means the drug coverage is expected to pay, on average, at least as much as standard Medicare drug coverage. Your plan is required to send you a notice every year telling you whether your coverage is creditable, usually before October 15th. Most people throw that letter away. Please don't. That letter is your proof. Keep every one of them in a folder, because a plan can be creditable one year and not the next. And if it stops being creditable and nobody reads the notice, the Part D meter starts running while you're sitting there thinking you're covered. And one more. The auto-enrollment assumption. A lot of folks believe Medicare just signs you up at 65. That's only true if you're already collecting Social Security. If you delayed Social Security to 67 or 70, which many of you watching have very smartly done, nobody enrolls you. There is no letter, no phone call, no safety net. You have to do it yourself. Quick pause. If you want everything in today's video in one place, check out the U.S. Senior Survival Playbook 2026. Social Security, Medicare, taxes, Medicaid, pensions, key forms, deadlines, all in plain English. Get your copy at robertretires.com, link at the top of the description. All right, let's talk dates. There are only 3 doors into Part B. Know all 3. Door 1, your initial enrollment period, 7 months total, the 3 months before the month you turn 65, your birthday month, and the 3 months after. That's it. And I'd tell you to use the first 3 months because if you sign up during or after your birthday month, your coverage start date gets pushed back. Door 2, the special enrollment period. This is the one for people working past 65 on real employer coverage. 8 months for Part B, starting the month after active employment or the group plan ends, whichever comes first. And note, for Part D, it's much shorter, only about 2 months. People remember the 8 and forget the 2, And that's how you get a drug penalty, even when you did the medical side right. Door 3, the general enrollment period, January 1st through March 31st. This is the "you missed it" door. Good news is the rules improved recently. Your coverage now starts the first of the month after you sign up, instead of the old rule that made you wait until July. But you walk through this door carrying the penalty. And one clarification, because this confuses a lot of people every fall, October 15th to December 7th is not for this. That's the annual enrollment period, and it's for switching Medicare Advantage and drug plans. It is not how you sign up for Part B for the first time. Now, some of you are watching this with your stomach dropping because you're already inside this situation. Don't panic. There are 3 real paths, and almost nobody talks about them. Path 1. The Exceptional Conditions Special Enrollment Period, Form CMS-10797. Since January 2023, Medicare has allowed people to enroll with no late penalty if an exceptional circumstance caused them to miss their window. That includes things like a federally declared disaster or emergency, losing Medicaid coverage, being released from incarceration, and this is the big one, being given misinformation by your employer, your group health plan, or your agent or broker. That last one matters because the single most common story I hear is HR told me I didn't need Part B. If you have anything in writing showing that, or even a written statement from you describing what you were told, that form is your shot. This window generally runs 6 months from the day you notify Social Security. Call Social Security at 1-800-772-1213 and ask about a special enrollment period for exceptional conditions. Path 2. Equitable relief. If you were given bad information by a federal employee, Social Security, or somebody on the 1-800-Medicare line, Social Security can waive the penalty, enroll you, or both. Important limitation: equitable relief does not cover bad advice from your employer. That's what Path 1 is for. Path 3. The Part D appeal. If a plan hits you with a Part D penalty, they must send you a letter about it, and there is a hard deadline printed on that letter, often just 30 days. Do not let it sit on the kitchen counter. If you had creditable coverage, send the proof. This is exactly why you save those annual notices. And if your income is limited, look into Extra Help, the Part D Low Income Subsidy. Qualifying for it eliminates the Part D late penalty entirely. Here's what to actually do. 7 steps. Pause the video and write these down. 1. Put your initial enrollment period on a paper calendar, 3 months before your 65th birthday month through 3 months after. Circle the start. 2. Get your employer's size in writing from HR, 20 or more or fewer than 20. That single number changes everything. 3. Ask HR for the creditable coverage notice for your drug plan, in writing, every year. Start a folder. Never throw one away. 4. If you're retiring, count your 8 months from the last day of active employment, not the last day of COBRA, not the last day of severance. Write the deadline date on the calendar in red. 5. If you are not yet collecting Social Security, understand that nobody is going to enroll you. Set a reminder 3 months before your 65th birthday to do it yourself. 6. If you have a health savings account, stop contributing at least 6 months before your Medicare starts. Part A can be applied retroactively up to 6 months, and contributions during that retroactive window become excess contributions with a tax bill attached. Different penalty, same kind of pain. 7. If it's your spouse's job providing the coverage, run this entire checklist twice. Once for them, once for you. The rules follow. Whoever holds the active employment. Let me tell you about a couple. Names changed, details simplified, but this pattern is very real. Dave turned 65 in March and took an early retirement package from a company with a few thousand employees. Great benefits. HR handed him the COBRA paperwork. He signed up for the full 18 months, and he told his wife they'd sort out Medicare when COBRA ran out. That felt responsible. It was the most reasonable-sounding mistake he ever made. His 8-month special enrollment period opened in April and closed in November, while he was still holding a COBRA card that worked at the pharmacy and the doctor's office. He didn't find out until the following autumn, when a friend at church mentioned the 8-month rule in passing. By then, his only option was the general enrollment period the following January. He'd crossed a full 12-month period, so he picked up a 10% Part B penalty, about $20 a month, for the rest of his life, rising every year with the premium, plus a Part D penalty on top. $20 a month doesn't sound like much, but Dave is 66. If he lives to 90, that's 24 years of a penalty that grows every January on money that was never at risk in the first place. The frustrating part isn't the amount, it's that the fix would have taken one phone call in April. So here's the question I want you to ask yourself tonight, before you go to bed. What is the exact date my active employment coverage ends? And what is the date, 8 months after that, when my Part B window closes for good? 2 dates. Write them both on a paper calendar where you'll see them. Because friends, this is one of the very few retirement mistakes with no undo button. You can fix a bad investment. You can adjust your withdrawal rate. You can change your mind about where you live. But this one follows you every month for the rest of your life. And it grows a little bigger every January. And it is completely, entirely, 100% avoidable with one phone call made on time. If this helped you, do 3 things for me. Hit that like button so more people your age see it before their window closes. Subscribe so you don't miss the next one. And in the comments, type the word forever if you want more videos on the Medicare deadlines nobody warns you about. And if you want all of this, Social Security, Medicare, taxes, Medicaid, pensions, the forms, and the deadlines in one plain English place, grab the U.S. Senior Survival Playbook 2026 at robertretires.com. Links in the description. Take care of yourself, and I'll see you in the next one.